CPHQ test questions and answers with explanations. 35 essential questions. Question 1. Which dimension of quality involves providing care that does not vary in quality because of personal characteristics such as gender or ethnicity? Safety, efficiency, equity, timeliness. Equity is one of the 6 domains of quality identified by the IOM, STEEP. Question 2. In healthcare quality, underuse is defined as providing a service that is likely to cause harm, failure to provide a service that would likely have produced a favorable outcome, using too many resources for a simple procedure, providing care that is not patient-centered. Underuse occurs when proven beneficial treatments, like mammograms, are not delivered. Question 3. Which tool is used to identify the root cause of a sentinel event? Flowchart, fishbone, Ishikawa, diagram, scatter plot, control chart. The fishbone diagram is a common tool for brainstorming potential causes and identifying the root cause in an RCA. Question 4. A PDSA cycle stands for plan, do, study, act, process, data, standard, assessment, patient, doctor, staff, administration, performance, design, safety, analysis. The PDSA cycle is a 4-step model for carrying out change and continuous improvement. Question 5. What is a sentinel event as defined by the Joint Commission? An expected outcome of surgery, an unexpected occurrence involving death or serious physical/psychological injury, a minor medication error with no harm, a scheduled hospital inspection. Sentinel events signal a need for immediate investigation and response. Question 6. Which type of data is number of falls per 1,000 patient days? Discrete, continuous, attribute, categorical. While falls are counted, the rate, per time/volume, is often treated as continuous data in quality monitoring. Question 7. Benchmarking in healthcare is the process of comparing one's performance to the best in the industry, setting a price for services, cleaning surgical instruments, testing a new piece of equipment. Benchmarking identifies areas for improvement by comparing internal data to external standards. Question 8. The Six Sigma methodology focuses on increasing hospital revenue, reducing variation and defects in a process, hiring more staff, improving the hospital's exterior. Six Sigma aims for near perfection by minimizing process variation. Question 9. Which of the following is an example of patient-centered care, involving the patient and family in care planning and decision-making, making the patient follow strict hospital rules, allowing the doctor to make all choices, limiting visitor hours to reduce noise? Patient-centered care respects and responds to individual patient preferences, needs, and values. Question 10. What is the primary purpose of a control chart? To identify the most frequent cause of an error, to distinguish between common cause and special cause variation, to track the budget, to list staff phone numbers. Control charts track process performance over time to see if a process is stable or out of control. Question 11. A lean approach in healthcare aims to hire fewer people, eliminate waste and non-value-added activities, purchase cheaper supplies, reduce patient discharge times only. Lean methodology focuses on creating more value for patients with fewer resources by eliminating waste. Question 12. Which organization manages the HEDIS, Healthcare Effectiveness Data and Information Set? The Joint Commission, NCQA, CMS, AHRQ. The National Committee for Quality Assurance, NCQA, manages HEDIS, a widely used set of performance measures. Question 13. In a Pareto chart, what is the 80-20th rule? 80% of staff do 20% of the work. 80% of problems are caused by 20% of the causes. 80% of patients are satisfied 20% of the time. 80% of the budget is spent on 20% of the patients. Pareto analysis helps identify the vital few problems that should be addressed first. Question 14. What is the main goal of utilization management? To increase the number of patients. To ensure that healthcare services are appropriate, necessary, and cost-effective. To build more hospital wings. To track the use of electricity in the facility. Focuses on the efficient delivery of necessary care. Question 15. An FMEA, failure mode and effects analysis, is used to analyze an error after it happened, proactively identify where a process might fail before it happens, determine the cost of a surgery, evaluate nurse performance. FMEA is a proactive tool used to prevent errors. Question 16. Which of the following is a structure measure in quality? Patient mortality rate, nurse-to-patient ratio, percentage of patients receiving antibiotics, patient satisfaction score. Structure measures refer to the physical and organizational characteristics of where care is delivered. Question 17. What does COPS measure? Hospital profits, physician credentials, patient experience of care, medication accuracy. COPS is a national, standardized survey of patients' perspectives of hospital care. Question 18. The term inter-rater reliability refers to the speed of a test, the degree of agreement between different people measuring the same thing, the reliability of a machine, the cost of an audit. High inter-rater reliability ensures that data is consistent regardless of who collects it. Question 19. Which leadership style is most effective in fostering a culture of safety? Autocratic, laissez-faire, transformational, bureaucratic. Transformational leaders inspire and motivate staff to commit to a shared vision of safety and quality. Question 20. What is the first step in a quality improvement project? Collecting data, implementing a change, defining the problem or goal, writing a report. A project must start with a clear definition of what is being improved, example, creating a problem statement.